My name is Christa. I'm a registered nurse lactation consultant, IBCLC, and I just wanted to share with you guys when and how to use a supplemental nursing system, which is an SNS. So I typically like to use these for C-section moms who really want to breastfeed, but their milk is not quite in yet. It usually does take a C-section mom 1 to 2 days extra for her milk to come in. Just because her body's a little confused to start making milk or healing the incision, okay? Also, preterm babies can benefit from using this because at the breast, they don't have that strong of a suck usually. They're using more calories than what they're getting. So this kind of gives them the extra calories so that the expenditure deficit is not as great. Also, for any adoptive moms or anyone who's trying to relactate, this is also beneficial, gets them back to their breastfeeding goals. I take all of this stuff into the patient room to set it up so mommy and daddy can see how everything is set up, cleaned, and talk about everything, okay? This is how it comes from Clean Holding. So you'll need that. Whatever formula we're using. If we do have a premature baby and mommy has been pumping, we can use pumped breast milk instead of formula. And then, of course, whatever size bottle we're using, 2 ounce, 1 ounce. And that's based off of baby's gestational age and how much baby's been eating in the past. So to set it up, this right here comes in our kit. I've already poured some formula into here. This piece right here comes, and then the white membrane, that's the part that goes inside. And then if you're setting this up with a patient, everything is in a book that's in here. It tells you how to set it up. It tells you how to clean it. Okay, this is really just for short-term use, just for a couple of days, honestly, until mom's milk comes in. So we're gonna get that set up, and then we're just gonna screw our lid back on, and then make sure our clamp is open. We're just gonna prime everything. I just have a basin here to catch everything, and I didn't screw it on good enough. All right, so I'm dripping formula at the bottom. And of course, if I was in a patient room, I would be wearing gloves for this. So included in this, we have tape as well, and we have the clamp. Half the time I don't use either of these because I have daddy that's gonna hold for me, and I have mommy that's gonna help secure it at the breast. But I also show them, it does take lots of hands to do this, as you can see. And since I'm doing this by myself, I will clip it on to my shirt. And it works by gravity, okay? And then I want to close this off so I don't keep dripping everywhere. So we would get baby to latch on. We would then slide this into the corner of baby's mouth. And then we would open this up, of course, so baby is eating. We can take our tape, secure it in place, or you have mommy right there, she can keep it in place as well, okay? So when baby's eating, baby's gonna be getting a little bit more than what would just be dripping out by the gravity. Baby's gonna be sucking and pulling more out. And then if we are using a nipple shield, so if mom's nipples are inverted or if baby has a tongue tie, any indication for a nipple shield, I put the nipple shield on, get baby to latch on, and then I like to put the SNS on top of the nipple shield, just so I have more control of it that way. You can do it inside, but I kind of get a little lost. It tends to be a little bit messier, that method. And then to take it all apart, so ideally baby would have eaten everything out of this bottle, but if not, we would just unscrew it, of course, toss what's left. And then this is going to be a little messy because I do still have formula in here. But this membrane we have to squeeze, pop it out. And then this right here hot soapy water to clean it. Same thing with this. You would dump the formula out of the bottle, put hot soapy water in here, and prime it up the exact same way you did with the formula. Clean it, and then you can also do it with just some hot water to continue rinsing it. It does recommend only using this product for 24 hours, okay? So like I said, very short-term use until mom's milk comes in. And then you can involve mommy and daddy. They feel that extra bond. Mommy is continuing to get stimulated. Baby's getting a little supplementation for whatever the need may be as a bridge until mom's milk comes back in and she's able to hopefully just breastfeed baby and not have to do any supplementation. Thank you.